That brings me to our next guest. So we have Dr. John Marcus and Dr. Crawford. They are with United Vet Care. They are going to be talking, as I mentioned, about keeping people and their pets safe at the vet's office during COVID-19. Gentlemen, welcome to Streamathon for Pets, and thank you for joining us early this morning here on Saturday morning.
Morning. Thanks, Ethan. Dr. Crawford and I are very happy to be a part of what you guys are trying to do. We've seen some really amazing providers and small businesses and other people trying to do the same thing. So I just wanted to give a little bit of a background of myself and Dr. Crawford. We're both practicing veterinarians and in different parts of the country, and have been deemed an essential business for this period that we've been dealing with COVID-19, and wanted to give some of our insights of what we've seen at the veterinary hospital, and some advice as far as keeping your pet safe through this time, and also some suggestions on how businesses can cope during this time, especially small businesses. So with that, Dr. Crawford is again a veterinarian. His wife's a veterinarian, and has been involved in the pet industry for a couple of decades now, and started a network of veterinary hospitals, about 30 hospitals across the country. I thought we'll start there. And hi, Dr. Crawford.
Thank you, John. Hello, everyone, and good morning to you. And thank you for tuning in for a worthy cause here. I think it would be good to kind of talk about the general status, as a lot of you know, of pets in our lives, and the trends of Snoopy in the doghouse up to today, where 60% of pets sleep in the owner's bed or more. Pets have truly become a part of our lives and a part of our family, and that human-animal bond strengthens every year. And through this process, we're seeing that reliance on that family member to reduce stress and to provide an area of comfort, even of greater importance. So as social distancing continues, we're relying on our pets more and more for our companionship, and they are an essential part of our family. So
over the last few months, just to give an owner the typical idea of what bringing your pet to a veterinarian looks like. We've dealt with a lot of other public health concerns through our careers, and I just wanted to get your insight on what's happening today if you're heading to the vet with your pet.
Yeah, so this is a very interesting time where we need to keep everybody safe within the network, and also service pets in need. And by doing that, we've needed to change the way we implement our practice and care for the pet and the clients. So we've implemented what we call curbside pickup and drop off. So very few of the exams, the owners come in, or the pet parents come in to the actual practice. You call and make an appointment, and when you come into the parking lot, we either recognize you or you call, and a staff member with protective protocols comes out, picks up your pet and brings them into the hospital. We've shifted our employees into groups or teams, as we call them. So we typically try to keep one doctor with a few employees on a given day, and then we rotate those teams through. So if if someone gets sick within that team, it effectively we isolate the entire team, but we keep the hospital running and functioning. So go ahead, John.
Sorry, and I mean overall, since the beginning of this pandemic, have you seen a lot of members of teams becoming ill or having COVID symptoms? It's a little off topic.
So we do have a focus of our hospitals that are in the Northeast, which is clearly the epicenter currently of the COVID-19 pandemic outbreak. And we have had a few of our team members actually test positive for COVID. And we've gone through various stages of how we've handled that from the very beginning, when we had a few employees that weren't able to get tested because of the testing but had the signs and symptoms. We shut down the entire facility, and we shut down 3 of our facilities for up to 2 weeks. As we've kind of become a little bit more sophisticated in the recommendations from the CDC and other governing bodies have changed, we've now more isolated the teams. And then if we do have a positive team member, we will close the facility for 24 to 36 hours, take the proper sanitation protocols. The facility is not, if we take the proper steps, the facility is not the carrier. And then we go back and continue to try to service our clients and pets accordingly.
That's great. I think having your employees' health and your clients' health, and also your patients' health as at the forefront is really important for what we're going through. I was curious, I know that I've seen a trend, at least, of an enormous number of new dogs with people now at home, isolating and self-distancing. And I was just curious what your thoughts were on the impact that's going to have to a lot of pet-related businesses, not only ours.
I think, as mentioned earlier, that the human-animal bond is very strong, and through these stressful times, and that people are at home, they're saying to themselves, this is the proper time to adopt a pet. And I'm seeing and hearing a lot of anecdotal reports. I haven't seen any published numbers yet of a lot of shelters and providers running out of pets or having record adoption rates. And we're seeing that in our hospitals where people are coming in with their new pets. I view it as an essential appointment, especially if it's a younger pet that's unvaccinated. We want to make sure that they do go through the proper health steps. The owner, pet parent, is educated on how to be a responsible and proper pet owner, and that is very important. So if anyone on this is an adoption center, I do highly recommend you referring them to your local veterinarian to have an essential exam and be educated on the health and welfare of the new family member.
Yeah, I couldn't agree more. I think with puppies and springtime coming, COVID is a real issue and a concern, but we also have quite a few other things that have been around for a long time, as far as viruses and parasites and things that can affect our pets and affect people as well. So it's essential to get these new animals current for those diseases, or protection for those diseases. What would you say to the pet owner who's reluctant to even come out the door? I know with human medicine, we're seeing more telemedicine, and I know we're starting to see more of that on the veterinary side. Yeah,
so there's two vernaculars or words that are important. So there's telehealth and there's telemedicine. And the difference between those two is telehealth is just recommendations and advice about certain kind of overreaching health aspects of your pet. Telemedicine is actually the diagnosing and prescribing of medication to your pet. And before COVID-19, there was a lot of state and federal mandates around the inability to practice telemedicine. States like New Jersey lightened and changed their standards around that, where they now allow you to practice telemedicine and not need to come in. So there's several apps and several companies out there that have partnered with your local animal hospitals, and that you will be able to do either telehealth or telemedicine, depending on some of the state and federal guidelines in your area. But it's a great avenue to either get the first wave of advice before you need to come in and risk both our staff and your safety.
I guess I thank you for that. One thing I wanted to go back to regarding the small businesses is we've been fortunate as veterinarians to continue or be deemed an essential service, and yet we've seen a decline in business and have had to furlough employees. And I guess my question is, what advice for the small business owner do you have for resources that are out there to help them keep their business alive and then thrive after we open up again?
This is not your typical recession or where we can just plan on some fiscally downturn that turns around. This is a public health and safety issue. So the most important thing is establishing proper protection protocols, creating teams, separating, isolating your units and your staff accordingly. If a lot of states and federal programs have come out between the PPP, the Main Street Act, the increase in federal unemployment dollars. So there's been a lot of benefit there. The difficulty part for a lot of our employees is there's so much confusion, and it's happening in such real time, and in the programs as they're coming out aren't necessarily completely clear. So being able to support and guide your employees in between those times until we truly understand the benefits of these policies that the governments are laying out has been the balance of trying to achieve I think that's
great. No, it's great. I think the more you support your employees during this time in some traditional ways and just being there for them is going to pay dividends long term with loyalty and people staying with you and helping your business. So
I think, John, it'd be good to just highlight for a minute, but not go too deep into it, about coronavirus in pets a little bit. Coronavirus has been around as a virus for thousands of years within all species of animals. So this isn't, when they talk about it being a novel or new virus, coronavirus is not new to the world. COVID-19 is a new version of the virus. But when the confusion thing, and you'll hear a lot of media and a lot of things about, can your pets get COVID-19? Pets can definitely get corona in their own, and viruses are species specific unless they mutate through. So in general, when you hear reports of a pet getting corona, it's most likely a a dormant host where it's coming from the human population into the pet, and the pet can be a carrier but can't then be a transmitter. And that's the current state of the science around it. I don't want to get too deep into it because it's very there's a lot of facets to it. I don't know if you want to add to that in detail, John.
No, I mean, I think that's well said. We are, learning as we go as far as the animals or pets involvement. Some basic common sense things are just going back to washing your hands. If you as a person are diagnosed with COVID-19, you want to obviously talk to your physician and follow the CDC recommendations. So, but again, these coronaviruses, although they're not identical, have been around, and we've seen quite a few of them with cats and other companion animals. So, yeah, that's.
Yeah, and then on the testing front, I think part of the frustration for the public in general when they hear about testing and the positives and negatives in our profession, we've been looking to how to properly test animals for corona for my entire career, and long before this, since the 60s and 50s, they've been looking at corona testing within pets. There's a lot of cross reaction. There's a lot of false negatives, a lot of false positives. So I think keeping that in mind when you do hear that a pet tested positive for corona or COVID, I would take that with a slight grain of salt, because the testing as of this point is not perfect.
Yeah, no, to add to that, Dr. Gary Whitaker at Cornell University has a lab dedicated to corona, and again, it's been for 30 years, and his explanations of why the testing is not black and white are really informative, I think, and you can access a lot of that info online. So
at Cornell, right, John? It's Cornell. He has a website at Cornell, correct?
At Cornell, yeah, Dr. Gary Whitaker.
Yeah, there's a lot of great information on there.
Yeah, I think another resource that I've gone back to is Temple Grandin, who was a teacher out at Colorado State, and yet she's not an epidemiologist or in human health. She has a very interesting perspective on figuring out solutions to the current situation, and just a different way of thinking, but a tremendous amount of experience with humans and animals. And so Temple Grandin's another great resource for reading on the topic currently. So Great. Again, ultimately, we're here to try to raise some money to help support all the small businesses that are out there across the country, from groomers to boarding to daycare facilities, pet shops and veterinarians. And again, I hope that we can help with that cause.
Well, we really appreciate you guys being on the show this morning, and of course, pitching why we're here. I know a lot of people out there. You answered so many questions that people have, and we've been so focused on, I think, our own health that maybe sometimes we forget about the impact that it has on our pets. And how they go about taking care of their pets. So that was really, really some great information. And I can't thank you guys enough for participating in this. And lending your knowledge to our viewers out there.
Great.
Did you guys have anything else that you wanted to add before we continue on? We've got our next guest that just came on the line. So, any final words or thoughts for anybody out there that's watching?
I wish everyone the best, and keep yourself and your pets safe. And thank you for your time.
Absolutely, Dr. Crawford.
And likewise, enjoy all the new pets and the time you get to spend with them and your families. And everybody be safe and happy.
Well, fantastic. That was Dr. John Marcus and Dr. Crawford